taking the time to come along to our webinar this evening. We're hoping at the end of this that you're better informed than when we first start. So we've got the 3 postgraduate deans with us this evening. We've got Sanjeev Ahluwalia, we've got Gary Wares, and we've got Geeta Menon. We're going to go through a brief presentation, and then there'll be plenty of time at the end for questions. If you can put them into the chat, we'll capture those, and then we'll come to them a bit further down in the presentation. Thank you. I'm going to hand you over to Gary now.
Thank you, Angela, for that introduction. I just want to say again, thank you very much for those of you who have taken your time to attend this evening. We really thought it was useful to reach out to you all as our educator networks, really so we could share the decision making and the reasoning behind the February 2021 pause. So as part of housekeeping, we'll try and answer as many questions as we can this evening, and I will urge you to use the question and answer function that should be on your screens for Teams Live, and we'll have a moderated Q&A session once the presentations have finished. We won't be able to enter into any specific trainee details today, and we would expect to answer questions really tonight on sort of high-level principles and guidance around the February 2021 pause. I really do appreciate this is a challenging time for the TPDs, our heads of school, our DMEs and our MEMs, and I really want, on behalf of the Deans and Angela's team at HET, to again thank you for the support that you've been delivering to the trainees. I also want to say thank you to those individuals who have reached out to Geeta, Sanjeev and I to offer your support around the very difficult decision that we took to pause the February rotations. And I know our DME networks and primary care networks have been working absolutely tirelessly to manage the redeployment process, as well now as this February 2021 pause. And really, again, to thank you for the work that you're doing to ensure that the trainees are, wherever possible, still trying to achieve some curriculum-aligned training wherever that's possible. The effort and support that we can see that you're all putting in is immense, and a real thank you again. So I think it's useful just to provide some context around what's going on in London. And Emma, if we could have the second slide, please. So over the week around the 14th of January, Sanjeev, Geeta, Angela and I began to receive an increasing number of requests from medical directors, chief executives, directors of medical education managers, raising the possibility of a February pause. And I think that there were some themes in those conversations, and thank you for those of you who raised this as an issue and a challenge. It was very clear to us that you wanted to achieve the best trainee support possible by maintaining familiar teams and familiar close support networks during this pandemic surge. As educators, some of you raised concerns and challenges around trainee well-being and the risks associated to trainees from moving from one redeployed rota to another redeployed rota, either within the same or a different organisation. We heard from a number of you around the concerns and challenges that you would have to support local clinical teams to absorb large number of trainees into a new and unfamiliar environment. And you brought concerns to us about how you would be able to manage that in a safe way, both for patient care, but also for trainee and learner well-being. And also, there was a theme around your concerns around educational capacity to support induction, onboarding, IT support and IT training, and familiarisation of the learning environment. Geeta, Angela, Sanjeev and I took those requests away, and we engaged with a number of system leaders, both in primary and secondary care. We spoke and engaged with our colleagues at NHS E&I, specifically Vin Dwarkar, the Regional Medical Director for E&I. We spoke to HEE National, and we had incredibly productive and useful conversation with the British Medical Association. I think everyone in those conversations acknowledged the requests, acknowledged the untold pressures on providers, and supported the position of pausing the February rotations as our provider colleagues had raised. And I'm delighted that the BMA Junior Doctors Committee members will be joining us when we reach out to the trainees at the trainee webinar next week. Emma, if I could have slide 3, please. I think it's useful just to play back to you all where we are today in the current London COVID situation. I appreciate that not all of you will be close to this. We're currently looking at a surge capacity of around 1,600 critical care beds, which is planned to plateau up to about 1,800 beds in the next week. We're seeing a rise in the cases at the moment of around 2% per day. London is looking for mutual aid and will be moving critical care patients outside of London to other regions in England. The Nightingale has come online for 66 step-down rehabilitation beds. We've heard from providers, DMEs and medical directors about high occupancy rates in general and adult beds, and a system that is really now challenged to meet those priority 1 and priority 2 patient activity episodes. To bring all that together then in a timeline, we predict that there will be a peak required for general beds around the 18th of January, and then that follow-on peak in critical care will be around the 24th of January. And it is expected that that peak on the 24th is likely to last at least and cross over the February rotation date for the first Wednesday in February. So I hope that gives some background to the context of where we are tonight and why we're having this webinar. So I'm going to hand over now to Geeta, and Emma, if you could go on to the next slide, please.
Thanks, Gary. So like Gary said, we've really looked very carefully at the number of trainees and the size of impact this is going to have. We were very pleased to work with the BMA and our junior doctor trainee representatives, as everyone wanted to consider trainee well-being, as we really appreciate and are hearing really loud and clear what the impact of COVID has been having on them. And you, as the educators there, have been supporting them through this really difficult period. London has a really large number of trainees, and about a third of them would have rotated either internally or across trusts, like you saw in the previous slide. And we also have some trainees that move between London and KSS mainly, or a few from into the other non-London trusts. The impact on trainees will vary, and there is an exceptions process that we have developed where trainees and TPDs can actually show a specific need, and we can actually look at those exceptions. So the idea is that there would be a process around this. The trainees and TPDs decide that there's a specific need, and then the head of school would then make a recommendation and the postgraduate deans would approve where possible. This is taking a whole systems approach, utilizing the dean's understanding and the networks on what position services are in and the exceptions that cover personal and educational reasons. Everyone is tired and we have some way to go before things improve. They keep saying that it's a marathon, not a sprint. With the BMA, we have actually asked the HR teams to agree some principles for London on the areas that really matter to the trainees, and we have agreed some common ground on around annual leave and pay, which will be well received by the trainees, as you can imagine. I'm just going to pass you over to Angela now, and we keep on the same slide, Emma.
Thanks, Lisa. Thanks, Gita. And just to say that we will share that document with everybody widely after this webinar and tomorrow, so that everybody's got those principles that have been agreed. So thank you. So we've got 3,291 trainee rotations that are all paused for 4 weeks, and we don't want to see this extended further. It's a careful balance of maintaining trainee wellbeing and patient care. We've shared with trainees information on how they can access our support services, and the BMA have made a similar offer. As with everything, communications is always key and is challenging with so many involved, and the need for national agreement, as HE is a national organisation. We sent a notice of intent out to our trusts and DMEs last Friday, but we have been asked to carefully synchronise the comms to the wider system to avoid any miscommunication amongst trainees. We do want to give an apology to the TPDs, because that was the one email that got stuck in our IT system. So an apology for us that didn't come out. It should have come out to you a few hours before it did. So lessons learned for us on that and the IT system. And then just I wanted to touch on the trainee information system. So that's our database, so where we put all the trainee details. So we will be updating all of the placement dates within the system. And it's important because this directly links to the electronic staff records. It links to trainees' pay records now. We will be working with trusts to let them know any of the exceptions. So when all the exceptions are agreed, we will make sure that those are also updated into TIS, so that TIS is an accurate record. We're going to need to work closely with HR teams on this, and we'll be holding a webinar next week with HR and medical education managers. And we've put a closing date on exceptions of the 22nd of January. So all of the exceptions need to copy the HR departments in when they're being requested and agreed. But on the 25th of January, we will be sending the trusts a list of all of the exceptions that we've agreed. Thank you. Could I have the next slide, please? And then I just wanted to touch on some of the work that the team have been doing, so that everybody's got a kind of view of it. So the HET team have been involved in helping to bring back trainees that were out on some type of the OOP. So not every OOP, but on an OOP-R, an OOP-E or an OOP-C. They've made just under 700 phone calls to trainees. It's been a voluntary process for trainees to come back. We've had a fantastic response, and so far we've passed 120 trainee names back to your HR departments to start back in service. So we really hope that that's helping with the response. So I'm going to hand over to Gary now, and we're going to take the presentation down and move to questions. Thank you.
Thank you, Angela, and thank you, Emma, for driving the slides. So we're going to try and pick up some of the questions that have been coming through on the Q&A /chat. If we don't get to your question tonight and get an answer for you, we will pull those together as a series of FAQs so that everyone gets to see all the questions that were asked. And the response. So Mark and Ollie are going to moderate the questions and put those questions to Angela, Sanjeev, Gita and I. Mark and Ollie.
Thanks, Gary. So I think the first question probably for yourself is, will the pause be extended beyond 4 weeks? And if this is being considered, will trainees be consulted?
Well, absolutely reach out to our trainee networks. Our intention, as Angela has already mentioned, Ollie, will be that the pause will be for no more than 4 weeks. I'll pick up a question, Ollie, that's there. There was a question about the document around HR. We will share that document this evening with the DMEs, MEMs, TPDs and heads of school network.
Thanks, Gary. And there's a question around, can trainees on OOP-R coming back in February still do so?
I think it's a little bit more specific around that question, Ollie. I'm not quite sure what the question is. So it's presumably OOP-R trainees meant to be coming back into clinical training in February. can still do so despite this pause, for example, into a COVID rota rather than remain in an unfunded post. So I think we took the position that if you were due to come back from out of programme, you could do so. I'm just going to refer that to Angela, actually, because I can't quite see the guidance I wrote.
Yeah, that's right. You're correct.
Yeah. Thank you, Angela.
Angela, there's a question here that might be worth directed to you in terms of pay issues for trainees not progressing to ST3 as planned in GP.
So when we share the guidance, that's in there. The pay issues are covered in the principles that the HR directors have agreed.
And then there's another question around the exception approval process. I'm saying, can providers be involved?
So I suppose the providers is quite a wide term, isn't it? So we've asked that the trainees liaise with the TPDs, and then the TPDs involve the trust HR departments. But what we're finding is that the DMEs and the heads of school, that there's discussion going on amongst a variety of people. But we have been specific in the guidance that they need to include the HR departments. Does that answer the question? I hope so.
I think it does, Angela. I think it does, yeah.
Thank you.
Thank you. So there's a question here which I think may be worth directing to Gary or Angela. Can internal rotations still happen within trusts?
I'll let Gary take that one.
Thanks, Angela. So going back to the principles of why we're here today, it was to release as much clinical capacity and relieve as much pressure on trusts and trust education teams as possible. I've spoken to a number of the DMEs today about moving trainees from one COVID redeployed rota to another. We will look at exceptions on an individual trainee basis, but we're not planning to look at exceptions for a whole rota, even within a provider. And that was very much the message that I got with my stakeholder conversations today. So thanks, Ollie.
Thank you. A question for Geeta here. Will HE provide access to peers support training?
Yes, HE has got a few things that are there in the professional support unit, and so it would be there would be availability of peer support training. Yes.
Thank you. And another question in terms of CCT. Will training be extended if trainees feel underprepared for CCT?
Again, this would probably be taken up on an individual basis, dependent on what the curricular needs of the trainees are. So you wouldn't be able to give a blanket answer. Gary, I think you agree, don't you? That
yeah, I mean, any extensions to training will need to be managed through the ARCP process. There's no other way of managing that.
Thank you. I think we're getting a few questions around trainees starting in February and about delaying their start. And are they being delayed, or should they be starting in February?
The new starters are all starting in February. They're not being delayed. All the new starters will start as planned.
It's probably worth just adding to that this is about a pause for trainees that are in rotation. That might be the simplest way of looking at it.
We've got a question here about the next rotation, asking, will the next rotations be shortened?
Yes, so that's the idea, is that the future rotation dates won't change, they will be as planned. So any, depending on whether you're a 3-month, a 4-month or a 6-month, you're just shortening that next rotation by 1 month.
So there's a question here about academic trainees. Are they due to rotate into their academic slots, or will that also be paused?
Gita, do you want to take that one?
Yeah, I think we are waiting for a national agreement through the NIHR to decide on what is going to be happening with the academic trainees. Currently, academic trainees have not been redeployed from their current posts. So we're just waiting for that national guidance, which hopefully we will get in a week or two.
While Ollie's looking for another question, in the guidance and exception process for those trainees who were due to start an academic clinical fellow or a clinical lecturer programme, and there is the appropriate academic activity taking place, we would expect those trainees to take up those posts in February.
Shall I just take another question while you're sorting them out in the background? There's one in there around the March rotations for paediatrics. So all the March rotations are planned to go ahead as they are. We are aware that some rotate on a Monday, some specialties, and so the ones that we've delayed will be rotating on the Wednesday. So there will be 2 different rotation dates in March.
So there's a question about, can new starters delay their start and remain in their current post?
New starters are not delaying their start, isn't it? They are starting as normal, so I don't know what that question is about.
I think it may be relating to starters that are currently working in trusts and looking to delay the start to their training post to stay where they are currently.
No, so that would be on an exceptional basis. We would be expecting trainees to start, and that also means that some trainees may be leaving London because February is a start date for some rotations that they've been recruited into.
So if the trainee is successful in getting an exemption, does there need to be a vacancy in the trust that they're due to rotate to?
Shall I take this one?
Yeah, thanks, Angela.
In an ideal world, yes, but we're not working in ideal times, are we? So we're going to be working with the trust on that. I think there's an expectation that we've done this in response to the system asking us to do it. So we're going to have to work with the system to make it work. Overall, the trainee numbers will balance. So I think we need to take a bit more of a global view rather than an individual post view. But the teams will be working to identify if there's any double running for trainees.
So the next question that we've got is trainees are concerned about getting their educational supervisor reports done and updating their e-portfolio. So whether there'll be any leeway on this?
Shall I take that one, Mark? I think that's definitely a question for the TPDs to work with the trainees through the progression of the curriculum. We still have to, we still have to maintain the ARCP and the progression requirements through a training pause. So I would suggest that trainees would raise that with the TPDs, because there's lots of nuances of different programs, Mark, that I don't think we can give a specific answer to.
And then a couple of related questions. So about trainees coming into London from out of London and whether they'll be able to come if the trainee hasn't moved out of the post they're going into, and also trainees who are returning from maternity leave, whether they'll be able to return back into work as well.
Angela, can you take that one?
Yeah, certainly the maternity leave, yes, the trainees will be able to start. As I say, I don't think it's not for the trainee to worry about whether the training post is vacant or not. I think it's for us and the educators to work out how we're going to make that work. So I think that's one of the considerations, and we're asking when there is an exception that's put forward, does it create any double running?
The next question relates to ARCPs, and just asking whether there's any consideration to pushing back ARCPs in the light of these issues to give a bit more time for trainees to have made things up.
I don't think we've got that far yet. So it's definitely one that needs some consideration, but I don't think we've got that far yet. At the moment, what we're saying is that ARCPs are one of the things that should continue. And we've got the derogated outcomes, and those derogated outcomes have been extended through to September. So I think when we start to look at the trainee recovery plans, we'll need to take that into account. I don't think we're going to focus today on trainee recovery plans. At the moment, we're just trying to help the system manage the kind of February pools.
So we have quite a few questions relating to GP, and in particular to GP trainees moving to ST3 in February, and around time spent in general practice in terms of CCT.
Come off mute. I'll pick that up. I was just about to say, Angela, we're going to do some separate piece of work around GP and primary care learners with the Rachel Roberts and the primary care deans, and we should be able to get that out to you in the next day or two.
I don't know whether Sanjeev wanted to make any comment.
No, thank you, Geeta. I was about to make exactly the same comment. I was about to make exactly the same comment as Gary has just made. Can you hear me okay?
Yes, we can, Sanjeev. So there's a comment here about trainees leaving London to train elsewhere in the UK who have already made accommodation changes. Presumably they can leave in February as an exception, and the answer to that is yes.
There's a question asking whether there are any dispensations for specific specialties in radiology.
Again, we'd have to look at it on a case-by-case basis. When we're looking at the exceptions, we'd have to look at it on a case-by-case basis. Like Gary said before, we are not planning to actually look at whole programs and then try and use that the exception as a method of rotating them. So it's really important that we understand that the process for exceptions is under really exceptional circumstances we are talking about.
So I have a question about how trusts will identify the new starters.
I think they already have the names of the new starters. Angela?
They would have had the names of the new starters, but I suppose we could probably do a piece of work if you're thinking that that's not clear, that we could always reissue that separately. I'm saying I'm going to look at Mark and Ollie to make sure I haven't said something wrong, but I think we could do that.
Ollie, there's a few questions around CCT around the end of January, early February. I think it's worth highlighting that CCT should not be affected by this pause. If a trainee was due to CCT at that time, they will CCT. There was another question, I think, around what happens after the CCT. Obviously, trusts would be probably willing to keep you in employment after a CCT. And again, we could probably manage that at an individual basis. I think it's really important to highlight we are having a pause in rotations, but we're not having a pause in education and training. So whatever education and training can be undertaken aligned to the curriculum within the pause rotation, that should continue at all costs. Ollie, I'll go back to you.
Thanks, Gary. We've got a couple of questions about mental health trusts, asking whether mental health trusts are able to rotate as opposed to the acute trusts.
Angela and yeah, I'm off mute. Angela and I are going to pick up with the mental health trust because there are some unique challenges there for our mental health trusts. Angela, is that right?
Yeah, that's right. We'll be doing that via the DME calls. So we have weekly DME calls, and we'll pick that up on the DME calls.
And there's several questions just relating to annual leave, with some references to annual leave having been cancelled, and the concerns for the trainee well-being.
So
yeah. So this is something that we had discussed with the BMA, and we have actually talked to the trust. Now it would be up to the trust. Unfortunately, we wouldn't be able to make too much. We can put some pressure, but not a lot, on organizations about what they stand they're taking about annual leave. But we have actually made it clear to the HR community that we would it would be helpful for the trainees if they could honor the annual leave that was already put in before they just knew that they weren't rotating. Angela, isn't that right? I mean,
yeah, that's right, and I'm pretty sure that's in the principles that have been agreed as well. So if it's booked, then they're going to try wherever they can to honour it.
There's a question relating to trainees who are acting up, who were due to finish at the rotation date, and whether they should return to the post and trust that they were in prior to acting up.
Ooh, that's a tricky one, isn't it? I've not had that one before. I think that's probably a negotiation between who's expecting them. I'll tell you what, we'll do a little bit of work on that one and add that on to the FAQs, which we're going to circulate tomorrow.
There's a question here around the professional support unit supporting educators' well-being as well as trainees' well-being, and is that something that can be done?
Yes, and interestingly, not just the professional support unit. I think the different trusts have also come up with various well-being sessions, etc. I can give you examples. I know that St. George's is doing a session or 3 days a week from 7 to 7:30 in the evening, where they have invited everybody. Anybody in London can actually sign up to that program. So yes, we are actually trying to make sure that, you know, well-being is kept at the center of all of this, and the PSU has also worked quite hard in trying to get stuff in. But I think that it would be even more easier if we actually also use some of the well-being aspects that are there in the different trusts and organizations.
If I may just come in there as well. It's important to also note that actually NHS E&I have a well-being offer for all clinicians, which is accessible to anyone who wants to access it. We mustn't also forget that Claire Gerarda's programme, PHP, is available to all doctors, free of charge and confidential. And we can certainly put the links to both of those services in the FAQ, and that will be available to all clinicians, whether you're an educator or a learner.
I think
we've got a question here in terms of the exceptions. Do you want heads of school to collate the exceptions, or do you want them to send them through, the ones that they support as they come in?
As they come in, they can send them through. We are planning to then have a meeting at the event on the last day to then sit down and look at all these exceptions. And like Angela said, we want to actually send those off to the trust on the 25th. So we are working to quite a tight deadline. So Gary and I will be looking at those exceptions as they come in and support them, or, you know, reject
Thanks,
them.
Geeta, just to reinforce, the exceptions should be submitted as individual trainee exceptions, not whole programme exceptions, please. Thank you.
A question relating to double running and the potential funding arrangements where double running is taking place.
Shall I just pick that up while I'm on camera? We'll pick up the individual double runnings through the DME calls, as well as conversations with the HR directors. You'll find a pay clause in the HR agreement document, which will circulate to you after this webinar.
Just one question more about annual leave, about whether it can be carried forward.
I think that is dependent on the employers, isn't it?
I think it's in the principles document. So when we share the principles document, that'll give everybody a better understanding. It's not our document, so I don't want to recite from it. I'd rather share it with you all so that you've got the whole thing.
We think that we've covered most of the questions that have been in. There have been some specific ones which we haven't raised that we can pick up separately. But we think those are the bulk of the ones where there are themes to follow.
Okay, that's really helpful. Thank you. I think what we'll do is we'll go through the FAQs, because I want to get the FAQ document that we've already started out to everybody tomorrow. But we'll go through these FAQs and add on any that are generic. If you've got particular trainee issues, then we won't be picking them out of here. So if you've got particular trainee issues, like Gary said at the beginning, you need to deal with us directly over those. I'll hand back to Gary then, because I think you were going to close.
Yeah. Thank you, Angela. Look, I think we all recognise from tonight that this is a really complex situation, and it's a really fluid situation that we find ourselves in. I hope that the exceptions that we've pulled together will allow a trainee focused, trainee wellbeing focused, and will also help to support wider organisations. We are aiming to reach out to the trainees in conjunction with the BMA next week. I think the date is the 20th of January, and I'm sure there'll be some similar questions coming through the trainee networks. As always, the deans, the deputy deans, Angela, Mark and Ollie and the rest of the HEC team are all around, and we will be as responsive as we can be to pick up and resolve the challenges that you're facing. Again, I just want to, on behalf of the group today, Sanjeev, Gita, Angela, Mark, Ollie and I, thank you for your time this evening. Thank you for your questions. It's given us some food for thought, and we will get these questions collated and back out to you in the next day or two as a series of FAQs. So thank you very much, and we'll bring the webinar to an end. Good night, everyone.